So let's talk about, for example, I'm in a place, someone collapses, and begins to have seizures. What do I, as the average person, no first aid experience, no medical training, how can I help in such a situation?
Okay, thank you very much. And I must applaud the person who made the video and your team for making that video. That was a fantastic video. And that was really well done, and it simplified a lot of things. And one of the things that I saw there was, this new craze of bringing out your camera to take pictures and do videos. I think recently around our church somewhere, somebody collapsed and was actually in cardiac arrest, and people were taking videos instead of looking for how to, do something to restore, so it's so important to talk about these things, honestly,
It's a
For
behavioral defect.
it's unbelievable. I mean, someone is dying literally, and you're
Yes,
just taking the video. It's terrible.
it is.
All right, so we have do's and don'ts for seizures. Because at this point, we can't say epilepsy, we'll say seizures,
Seizures,
because
yes.
we don't know what is causing it in that person at that time. And I mean, my husband called me one day. He was in the banking hall and he said a child has just started convulsing in the banking hall. What should he do? And that really tells me how easy it is for this to happen anywhere.
Yeah.
I've had it happen in a classroom. Students were writing an exam and the student just collapsed and started convulsing, So it can happen anywhere. So everybody needs to know this. So the first thing you want to do is to put the person on the floor. Most times you're not in a hospital setting, you don't have a hospital bed, you don't have all those things. So just put the person on the floor. And the reason is that, like we said earlier, this person is not conscious. He doesn't know where he or she is. This person is not aware of his surroundings. And in the process of the jerking and everything, he can fall down. If you put him on a chair, if you put him on a table or a bed, he can roll off. And so you need to put them on the ground where they'll be safe. Okay, so that's the first thing. Next thing you want to do is turn them on their side. Every time a person is having a seizure, usually there are a lot of secretions. I'm sure we saw the video, and you saw, he was frothing at the mouth, a lot of saliva and secretions. And because this person is not conscious, some of those secretions can go into the lungs. The secretions can go the wrong way and choke the person, and that will be more dangerous than even the seizure sometimes. So you want to turn the person on their side so that all those secretions can pour out. Next, you want to clear the area around the person. Are there chairs, tables, sharp objects, stones, things that while the person is, jerking and thrashing, they can hit their legs on those, and those things can injure them. So you want to make the area as safe as possible during this episode of the seizure. The next thing you want to do is to try and cushion the head. So you look for a rag, look for a shirt, look for something, roll it, let it be a bit soft like a padding or a small pillow, and put under the person's head. Most times when the person is jerking, they will also be hitting their head on the ground, and that can also lead to more injury. So you want to cushion their head. Next, you also want to remove glasses, any constricting jewelry or clothing, maybe they are wearing a tie or they are wearing a necklace that may be tight. You want to take all those things off. Why? When a seizure is happening, all the cells in the brain are working overtime, and the brain needs air, needs oxygen. So during that seizure, if you don't allow this person have enough air, they may lose some of these neurons. These neurons may die because they are not getting the oxygen they need. And that means that at the end of that seizure, that person will have more brain injury, and you don't want that. So during the seizure, you try and remove anything that can block the air from going into their lungs, into their chest. So remove ties, tight clothing, necklaces, and all those kind of things. Finally, you want to keep an eye on the clock. So from the minute the seizure starts, you send somebody for help, before you even start putting them on the ground and everything. If there are people around, hanging around, quickly send someone, please go and get us a vehicle, go and call for help so that we can take this person to the hospital. Everybody who has a seizure needs to go to the hospital, okay? But in the process of waiting for help to arrive, people to come around, you want to keep your eye on the clock. You want to know how long this seizure has lasted. Why is this important? Most seizures will stop in less than 5 minutes. So before you even call for help and run around, the seizure has stopped. But if that seizure continues, you want to have an idea how long, so that by the time you are going to the hospital, you have that information for the doctors. Usually, most seizures that last more than 5 minutes are unlikely to stop on their own, so they will definitely need the hospital intervention. Even if the seizure is less than 5 minutes, by the time you are taking the person to the hospital, the seizure has stopped. It's still important to go to the hospital. So getting someone to help you take patients to the hospital remains very important, just to make sure that there's nothing else that can be done for that person, you know. So these are the key things you want to do. However, there are some don'ts. So the first don't is that you do not restrain this person or hold the person down. Sometimes when someone is having a seizure, you see people holding them down, putting their hands straight, forcing their hands to be straight. I've had a few cases where the person will suffer a dislocation because the force of people holding is too much, and this person is not conscious. He doesn't know what is happening to him or her. So holding them is not going to stop the seizure until the seizure that is happening in the brain stops. That seizure will not stop. So there's no point holding the person and causing more harm to this person. Okay, so don't hold them, just leave them. Make sure the area is clear. People move back so that they can get enough air. But don't bother holding the person and trying to hold the seizure. It can't work. It's not there. They are not doing it intentionally. 2, do not put anything at all in the mouth, whether drink, food, drugs, onions. People do all sorts of things. Some people even put rub in the eyes. I've had a story of someone that burnt the feet of the child, used fire to burn the feet of the child because they were trying to make the child wake up from the seizure. So please do not put anything in their mouth. Like we said earlier, this person is not conscious of what is happening. So it's like you are giving someone that is unconscious food. It's like you are force feeding that person. What will happen is that the food will go the wrong way, and that will cause even more problems than the seizure. Within 5 minutes, seizure is over. The person will now be having trouble breathing because you have forced something down the throat that is not supposed to be there. Do not put spoon in the child's mouth or in the adult's mouth. Why? When you put a spoon in the mouth, the person is likely going to be clenching their teeth on that spoon, and they'll be doing a lot of force, and sometimes they may dislodge one of their teeth, and that tooth can go back into the throat and go and block where air is supposed to pass, and then you will now be running around for some. The person will now be struggling for air even when the seizure has stopped. So this is one of the most dangerous things about putting something in the mouth. You can cause more problems than what the person had before. Do not do mouth-to-mouth resuscitation. A seizure is not collapse. So some people will collapse and stop breathing. Those are the ones you do mouth-to-mouth resuscitation for. You do chest compression like CPR. But when someone is having a seizure, that's not the time to do mouth-to-mouth resuscitation and all those things. No. If you force air into someone that is convulsing, it will push the secretions back inside the throat and cause problems again. Do not attempt to bring them around. What does that mean? Don't try to wake them up. Don't do anything to try and wake this person. The person is not aware. It's not intentional. It's not sleeping. This is unconsciousness that is associated with jerking. This is a seizure. So these are the major do's and don'ts for the management of a seizure. For anybody at all, any layperson should be able to know these few things.
Okay, so what lifestyle habits help reduce the risk of seizures in both children and in adults?
Okay, so that's a tough question. So for children, most of the things that will cause epilepsy are kind of outside of their control. So problems that happen while they were in utero, that's when the mother is still carrying the child. And that's not really up to the child. So here we talk to mothers, we talk to women, and we say that take your folic acid. If you're planning to have a baby, be on folic acid, because the most important time that the folic acid is needed is in the first 3 months of that pregnancy. And at that time, many women don't even know they are pregnant. And so if you're of reproductive age, it is advised that you be on folic acid. It prevents some brain malformations from happening. So that's very important. And then, of course, you shouldn't drink, shouldn't smoke. These are all things that can cause damage to an unborn child. So these are all things you want to avoid. Now, when it's time to have a baby, at the time of delivery, you must be very cautious, because that's a very sensitive time. If a baby is born and does not cry at birth, it can damage the brain. So you want to make sure that you are having a baby in a setting where people know what to do in case the baby does not cry. About 70% of babies will cry, but some will not, and they will need some help. So you want to make sure the baby is born somewhere that they know what to do. After birth, a baby can have something we call jaundice. Jaundice in an adult will not damage the brain. People see people with liver problems, their eyes are yellow, but in a newborn, there's something we call the blood-brain barrier, something that protects the brain from anything that is in the blood. But in a newborn, that barrier is not very good. So anything in the blood can get into the brain and damage it. And so the new brain is very sensitive to jaundice. So if there's high level of jaundice in the blood of a newborn, it can cross into the brain and damage the brain. And these are things that can all cause seizures later in life. Okay. And then other things like birth trauma. So you have some babies, they come out, and the baby is too big. And so the baby stays so long before they're able to push the baby out. And the baby comes out, it's so weak, cannot cry, the brain is damaged, and we start to see problems later in life. So these are the major things for children. And then the big one, infections of the brain, particularly, like I said earlier, meningitis. So a small child, less than 5 years, has any severe infection in the brain, even though the child recover, later on, that brain may be scarred or injured. And so later on, the child will start having epilepsy. So I always encourage that as a parent, you don't waste time when your child is sick to seek for care. Don't stay at home. Don't be doing self-medication. By the time you are doing 24 hours, this child is not improving. Don't waste time. I know that there are some minor things, cough and catarrh, or a mild fever. But by the time a child is sick for more than 24 hours, child is deteriorating, there's no improvement, please do not delay. Not everything is malaria. In fact, we had some patients recently, 3 children from one family with meningitis. All of them on admission at the same time. The mother just thought, oh, it's just headache. It's just this. The child just kept going down. By the time she got to the hospital, one of the eyes was looking the other way. When you see people that have squints, sometimes they are not born that way. Some of these infections have caused this. So don't take everything lightly. Have good health-seeking behavior. Look for help on time. Don't waste time to get help. So these are for children. For adolescents and adults. So for someone who has a diagnosis of epilepsy already, we know this person has this tendency to having seizures frequently. One of the first things we do is to put them on medication. So we have medications for the different types of epilepsy. And like I said, if we don't control these seizures, it can progressively lead to more and more injury. And so if you have family members or anyone who has epilepsy from when they were very young, if they did not get care early, as they grow up and continue to have seizures, they start to decline in their school performance and all that. So it's really important that they don't continue to have seizures. So even though this person, yes, has this diagnosis of epilepsy, you don't want them to keep having the seizures. So the first thing is to take their medication, and they need to take it regularly as prescribed. And it's not as easy as it sounds. And that's why it's important to emphasize. Taking drugs every day is not easy. You can ask any of your parents who are on antihypertensives, antidiabetics. It is so you want them to be consistent with them. It's easier in children because in children, their parents are giving them. But when they get to that age where they need to take it themselves, you will be shocked at how non-compliant many are. So that compliance is so important. Whatever you need to do to be compliant, please do take your medication. For adolescents and adults, one of the key things is abuse of substances. So people using tramadol, taking drugs, sniffing things, these things can have injurious effects on the brain. So you have to be very, very careful. It's not everything you drink. It's not everything you sniff. Oh, it's raining. My friends are doing it. You have to be very careful. So we must be responsible about what we allow to come into our systems. So substance abuse is a huge thing. The other thing is accidents. And this is why also using substances is dangerous, because when you drink, you lose your inhibitions, you drive anyhow, you get involved in an accident, and then this person has head injury, gets better, and then later starts having seizures. So accidents, but even for adolescents, because at that age, there's a lot of recklessness, and all that, and then you start using things, oh, my friend doing this, and then you start having issues, and everybody's running helter-skelter, trying to figure out what is going on. And sometimes you never know because they won't tell you, and if you don't test, you won't know. yet this person will be having seizures. So these are some things that can cause seizures in older people, apart from these things that may come, because some of these things, when they start from childhood, like you said, they will track into adulthood and the person continues to have them. But apart from those, these other things are some of the common issues. Then, like I said, brain tumors. We've had quite a number of that happening. So once someone has a seizure, please seek help, because you just might be sitting on a keg of powder. We had a girl come to us. She had been having seizures for 3 years. And so if you looked at her, you just think, oh, she's normal epilepsy, maybe it's something in the family or something. But for some reason, we said, oh, let's do imaging. And we did, and we saw a huge tumor sitting there, and it was amenable to surgery. So if we hadn't done the test, if they hadn't come to the hospital, the tumor would just have been growing. And they will say, oh, she has epilepsy. Nobody will know that something is happening inside the brain.
Are there any limitations to individuals living with epilepsy to live full, active, productive lives? Like children, is there any limitation on how much they can play? Can they go like on slides, for examples? Can they bounce up and down the trampoline?
Generally, we say that there are really no restrictions on your lifestyle, really, except for these few things. And these few things that there are restrictions on are mostly for your own safety. Once you're taking your medication, the rest is to keep you safe and others safe. So that's why we say, oh, don't operate heavy machinery, don't drive, it's for the safety of people around you. But generally, we would encourage things that are good for brain health. So number one, enough sleep. You need to have at least 7 to 9 hours of sleep every day. This is good for everybody, not just people that have epilepsy. That's why I'm saying that it's not like a specific thing to them, but we know that these things generally help brain health. And I know that we do tell our patients, particularly those that have not gotten control very well yet, to make sure they don't take them for all-night sessions where they don't get to sleep. Those can make the seizures become a lot more. But generally, for good brain health, sleep at least 7 to 9 hours every day. It sounds simple, but trust me, many people are not getting up to that amount of sleep. So 7 to 9 hours of sleep are very important. Then they need to eat well. So the brain is a very interesting organ. It doesn't use anything except glucose. Some other organs can use fats and proteins and all that to work, but the brain needs pure glucose. So if you don't eat, your brain is starved, and a starved brain can have seizures, even for someone that does not have epilepsy. So you want to make sure the person is eating well. So eat regularly, eat consistently. It's important. It gives enough substrate to the brain. Many of my adolescent patients, this is a problem because maybe they are trying to lose weight, especially the girls, to fit in with their friends. They are not eating well, and then they'll be having epilepsy, So they need to eat well. Many of them, they skip breakfast. If you check very well, they won't eat in the morning. They are rushing out to school. They will skip meals, So don't skip meals. Eat well. Rest well. So those are the major things. And then, of course, like I said, avoid substances. Alcohol, particularly. Avoid alcohol, all these drugs and substances that people use to make themselves feel good. They can trigger seizures. And if you're not careful, they can actually trigger strokes sometimes. Some of these cocaine and some of these stimulants substances that people inhale and take, So they can even lead to strokes, seizures, and all that. So avoid all those things.
Thank you very much. This particular topic, has really been, I would say it's been a burden, because I know that it's traumatic, not only for people living with epilepsy, but also for caregivers and for people around. So for me, it was very important that people got the real information. There's so much myth surrounding it. There's so much disinformation. And it's not surprising. Epilepsy has been around for centuries. And so fears will have been transferred from generation to generation. Misinformation will have been transferred. So I'm very glad, because even I have learned so much from this conversation. Thank you very, very much. It's been a wonderful time chatting with you. I look forward to, having you back many, many more times on the program. You've made the topic so lively. It's a topic that has this dark cloud over it. So for us to have been able to talk about it in such an uplifting and in such an encouraging manner, I'm very grateful. So thank you very, very much. God bless you.
You're welcome. Thank you very much, ma'am.
Thank you all for being a part of the Mindset today. I've had a very, very enlightening time with my guest, Dr. Joy Alejo. I look forward to seeing you on the next episode when we shall be addressing yet another topic on the issue of health and well-being. Until then, I am Yetunde Adenike. Be kind, be compassionate, take good care of yourselves and one another. God bless you all.